Hello, I am Dr. Kiran Godse, consultant dermatologist from Patil Hospital, Navi, Mumbai. Today I am here to talk about urticaria and its management during COVID-19 outbreak.
What is urticaria?
Urticaria or hives is a disease characterized by red itchy wheals all over the body. It affects almost 1% of the population and it can present as a truly itchy rash all over the body.
What is the clinical relevance of urticaria and COVID-19?
During COVID pandemic, urticaria has become an important disease because COVID infection can present as urticaria, hives, fever and various signs and symptoms which gives us a clue that patient is suffering from COVID-19 infection.
What are some triggers that people must be aware of?
The common triggers for urticaria are food, especially seafood, eggs, Chinese food, colored items and frozen foods. Drugs like painkillers, antibiotics also can trigger urticaria. Similarly, infection, a bacterial or viral infection also can trigger urticaria. And last but not the least, a stress or severe anxiety can also trigger urticaria.
How can people identify that they are suffering from urticaria, and when should one seek medical advice for the same?
If you are suffering from hives or urticarial wheals all over the body, it's time to go to a dermatologist. Dermatologist will do some basic tests to find out the cause of urticaria. Again, please remember that COVID-19 infection can present as a fever and urticaria.
What are some challenges faced by the dermatologist in treating urticaria, especially amidst the pandemic?
Challenges faced by dermatologists treating urticaria are many. First of all, patient cannot come to a clinic to take regular treatment and follow up. Some patients may stop the treatment suddenly and get flares. Potent treatment like cyclosporine cannot be given during COVID infection as it can reduce body's immunity. But effective medications like non-sedating antihistamines and biologics are the mainstay of therapy during COVID-19 pandemic.
Can you please elaborate on the available treatment modalities for our viewers?
Available treatment modalities to treat urticaria are many. Most important is use of modern non-sedating antihistamines which needs to be taken regularly. It can be updosed up to 4 times to control the hives. If 4 tablets do not control your urticaria, then it's time to go for second line treatment, and that is use of omalizumab, a biologic, or cyclosporine, immunosuppressant. Your doctor will decide which is the best treatment for you. Remember, the treatment can go up to 5 to 7 years. So please take a regular treatment and get free control of urticaria.
Is urticaria the most common cutaneous manifestation seen in patients with COVID-19?
Urticaria is the most common manifestation of patients with COVID. It can affect 2 to 5% of the patients with COVID. So if you have urticaria with fever, please visit a doctor.
Can people already suffering from urticaria safely take the COVID-19 vaccination?
If you have urticaria, vaccination is not the contraindication. Please go to nearby hospital and take COVID vaccination and do not stop antihistamines.
To what extent do psychological stressors play a role in the aggravation of urticaria and its symptoms? And how must one cope up with the same?
Anxiety and depression can worsen urticaria. So patients suffering from urticaria may have a worsening of the disease due to concomitant anxiety and depression. So it is important to consult a psychiatrist for these elements so that urticaria can be well controlled.
Do you think with advancing medicine and technology, can urticaria have a permanent cure?
Well, urticaria is a disease which can stay up to 5 to 7 years. Permanent cure is not yet possible, but a long remission is possible. But with advancing science, we have got many new biologics coming which in future can actually give a cure to urticaria patients.
As a dermatologist, what would be your advice or take home message for the viewers?
Remember, urticaria is a disease which can be easily controlled with regular use of medicine. Treat the disease until it is gone. Do not stop medicine abruptly. Typically, treatment is safe in long term without major side effects. So take treatment and become free from urticaria.